The definitive guide to facial feminization surgery. When we look at the face, there are certain features we associate with classical femininity. A smooth, high brow line, full lips, round cheeks, a tapered jaw, a smaller nose, and a slightly pointy angular chin. These are the shapes that tend to make a face look female. At my practice in Beverly Hills, I specialize in helping individuals achieve a more feminine look, whether they be females who have some masculine features or individuals who desire to change their facial gender orientation. The results are life-changing for my clients who consistently report that they enjoy a new sense of confidence now that they look as feminine as they feel. What is facial feminization surgery, or FFS? Facial feminization surgery is a type of cosmetic surgery that combines various bony and soft tissue procedures at once to create the overall effect of a more feminine appearing face. As opposed to surgeries that address only one problem area for the client, facial feminization surgery is a comprehensive approach that employs multiple methods to achieve dramatic feminization results, often in a single procedure. Good candidates for facial feminization surgery are those women who are self-conscious about facial features that society typically views as masculine, or patients who desire facial gender reassignment surgery. We work with cisgendered women all the time who were born biologically female but have struggled all their lives to feel beautiful because certain aspects of their face appear manly, such as a deep brow or a low brow, or a very prominent chin or jawline. We also work with transgendered individuals and non-binary clients seeking to feel more at home in their bodies and faces. Facial feminization surgery can be a especially transformative step for those clients as it helps them to live their gender identity with greater joy and greater confidence. In fact, for trans individuals, facial feminization surgery has been shown by numerous studies to have an even greater positive impact on mental health than does genital feminization surgery. There are relatively few plastic surgeons who do full facial feminization surgery, so you may need to travel in order to get it. In any case, be sure to select a surgeon with proven experience in this highly specialized procedure. Your face is your most precious asset, so you need to work with an expert you can trust. You are not only selecting a doctor, you're selecting a designer and artist, one that must communicate with you. So shop around until you find the right surgeon that feels right to you. What should I expect before and after facial feminization surgery? If you're considering this surgery, the first step will be an initial consultation with your surgeon. At the consultation, your surgeon will examine your specific facial features, talk with you about your goals for surgery, and describe the various processes he or she recommends to achieve the desired effect. Your surgeon will also go over any pre- and post-operative instructions and give you an idea of just what to expect following surgery. If you take hormone replacement therapy, you may need to stop it for a couple of weeks prior to surgery and for a couple of weeks afterwards. If you smoke, your surgeon may require that you quit smoking in order to ensure adequate blood flow for the healing process. Fasting, of course, will be required the day of surgery. Most surgeries require general anesthesia for the duration of the procedure and may or may not need an overnight stay, depending upon how many things are combined. Some people who undergo facial feminization surgery opt to do it in two procedures, usually one that covers the top part of the face and another that covers the bottom, but this sometimes can be done all in one procedure. Your surgeon will advise you on the best course of action for your specific situation. How much does facial feminization surgery cost? The cost of the surgery varies considerably based on where you have it done and on who does it. Unfortunately, facial feminization surgery is usually not covered by insurance, but many surgeons offer financing options. In the United States, facial feminization surgery usually costs anywhere from $20,000 to $50,000 out of pocket. Your surgeon will give you a more detailed estimate and maybe break down the costs. You may choose to forego certain suggested procedures in order to keep costs down if necessary. What are typical procedures in facial feminization surgery? While I tailor procedures to each individual client and to their face and to their wants, some of these might be typical procedures. 1. Hairline advancement. Advancing the hairline by moving it forward and shortening the forehead can have a dramatically feminizing effect on the face. Nose. Rhinoplasty to reduce the size of the nose and to reshape it is a common procedure in facial feminization surgery. Jawline and chin. Shaving the lower jaw and bone or repositioning it can reduce the width and angularity of the masculine-looking jaw. Buccal fat removal in this region is also a great option for those seeking a slimmer and more contoured jawline and face. Brow lift. Lifting the brow to a higher position on the face helps counteract the masculinizing effect of a deep or furrowed brow and reduces telltale signs of aging like forehead wrinkles and crow's feet. Lip lift. Bringing the upper lip closer to the nose, shortening the white lip, and everting the pink lip makes the lower half of the face look younger and more feminine. Facelift. A facelift is usually performed during facial feminization as it makes the face appear less bottom heavy and more heart-shaped. What are the recovery times and phases? Your recovery time will depend on your general health, how vigilant you are about aftercare instructions, and how extensive the procedures are that you're deciding to have. Generally speaking, you will need complete rest for about 2 weeks and should not go back to work or heavy lifting for 3 to 6 weeks. You will likely need a friend or family member to help you care for yourself following surgery, and you should avoid strenuous tasks and unnecessary stress. Be sure to attend all follow-up appointments and call your surgeon's office right away if you're concerned about any potential complications. It's always better to be safe than sorry. Is swelling normal after facial feminization surgery? Of course it is. Swelling is to be expected after facial feminization surgery, especially because we're often doing a number of procedures at once. It's major surgery, and complete recovery will take several months. As with all invasive cosmetic procedures, things are likely to look a little worse before they look better. Your surgeon will monitor your swelling in the post-operative follow-up visits and will let you know if there's any cause for concern. He or she will also check for signs of infection, and really, if it's someone like myself, I'll be with you every step of the way to make sure things are healing properly. What are the general risks of facial feminization surgery? The most serious risks of facial feminization surgery are the same as any procedure requiring general anesthesia for an extended period of time. There's always a risk of an adverse reaction. This is rare, however, and your surgeon will order preoperative tests to make sure that you're a good candidate and in good general health to undergo the surgery. The other risks of facial feminization surgery can be reduced simply by selecting the best surgeon for the procedure. Scarring, blood clots, implant infection, suture rupture, nerve damage, facial asymmetry are really not very likely if you choose a practitioner who's experienced, with a proven track record, and who does really careful surgery. That being said, you should always feel comfortable discussing any questions, any risks or complications with your doctor so that you can make an informed decision and be aware that all surgeries contain some element of risk. Are there non-surgical facial feminization procedures? There sure are. If you're worried about going under the knife, talk to your practitioner about non or minimally invasive cosmetic options such as injectable fillers, botulinum toxin, or a thread lift procedure. There are many ways to feminize your face without undergoing surgery. They may not be as complete, but they still work. Commonly, clients seeking non-surgical feminization opt for injectable fillers in the cheeks, in the lips, botulinum toxin to narrow the jawline, eyebrow reshaping, hair transplants, or facial hair removal with a laser. While surgery will produce more dramatic and permanent results, there are plenty of ways to achieve a more feminine look that don't require general anesthesia and don't require lengthy recovery times. Do I need a facial feminization plastic surgeon near me? Patients should expect to travel for an expert. I see many patients that come from a long distance. Because there are only a handful of expert plastic surgeons in the country, patients should expect to travel to a location like Beverly Hills for their procedure. Do you have questions? I work with patients like you every day. Call or email me to schedule a consultation and appointment. I look forward to seeing you in my office. Thanks for watching.